For years, surgical facelift was the gold standard for sagging face, neck of the face. However, today, so if you have a significantly sagging skin and the skin has lost its elasticity, does not have the capacity to rebuild collagen, such candidates definitely need a endo laser, which is 1470 nanometer laser, which is the greatest innovative technology today. And we are in South India and Indian skin, sometimes the scars can pigment hypertrophy, and if a patient does not want scar, then I choose a facelift versus energy lift. Can you skip a surgical facelift? This is Dr. Jayanthy, a board certified plastic surgeon from Tamira Plastic Surgery. For years, surgical facelift was the gold standard for sagging face, neck, and significant aging of the face. However, today we have multiple energies and other technologies which on combination can give you a result which can either delay or surgical facelift, or if started early can even prevent or avoid a surgical facelift, thereby replacing a permanent surgical scar. In surgical facelift, it is a complete removal of excess skin and lifting and tightening of the SMAS layer, which gives you a dramatic change and long lasting result. However, it comes with significant downtime, and of course, there could be complications, and complications which means it's like driving a car. When you follow all safety standards and the car is in a good condition, most of the time accidents don't happen, but rarely it happens. So complications in surgical facelift is very, very rare. But then who are the actual candidates who need a surgical facelift? So if you have a significantly sagging skin and the skin has lost its elasticity, does not have the capacity to rebuild collagen, such candidates definitely need a surgical facelift, which means removal of these skin which has lost its elasticity, which have extended and become lax, and also when there is significant descent or laxity of the facial tissues with significant bands in the neck and skin elasticity. These candidate definitely needs a surgical facelift. However, today we have multiple non-surgical technologies. Let's start with endo laser, which is 1470 nanometer laser, which is the greatest innovative technology today in non-surgical face and neck lifting segment. Then we have high intensity focus ultrasound, commonly referred to as HIFU. You have Altira, which is also used as ultrasound, but with a different technology. Then we have radio frequency in terms of body tight, which is a minimally invasive technology. And we also have Morpheus 8 MNRF or Silfirm X, which is also MNRF, which is used from the outer surface. And in addition to this, we also have threads, the Aptos threads, which comes with hyaluronic acid, and thereby their latest technology, the Namika technology, which keeps releasing the hyaluronic acid over a period of 18 months to 2 years. And we also have other threads called test scaffold threads, where there is barbs which are engulfed in a scaffold of PDO threads, which actually enables tissue to grow in for a stronger lift. In addition to this, we also have fillers or injectables, where when you have lost volume and there is a volume enhancement, so that when you consider fat grafting on one side, we have injectables on the other side. And we also have fillers that can also move with facial animation, like the recently launched one in India called Thioxane filler. So we have a combination of all of this. So on one spectrum of anti-aging and facelift, you have surgical procedures, we have a short scar facelift, and you have standard facelift, you have deep vein facelift. On the other spectrum, you have multiple energy devices, And if you ask me what my preference is, I like to combine. At times, I combine a short scar facelift, which is called a max facelift, minimal access cranial suspension, taught by my mentors, Dr. Patrick and Alexis Wapale, under whom I trained. And I combine that with energy devices and injectables if required. Or on the other hand, if the patient does not want scars, and we are in South India and Indian skin, sometimes the scars can pigment hypertrophy, and if a patient does not want scar, then I choose endolaser and combine with threads and some injectables as well to give a comprehensive solution. So now, if any of you are looking at anti-aging procedure and if you're not clear what is the best choice for you, we have teleconsultation. You do not have to walk into the clinic. You can visit our website www.tamiralife.com and you can book a teleconsultation, which we do as efficiently as an in-person consultation, and we can give you a complete plan as what you would prefer, and of course very transparently all the options that's available, and then helping you through to understand the pros and cons and what each one can deliver. It's not that one replaces the other, each one can contribute, and we will explain all of this, and then you can take a decision. If you or any of your friends have been thinking about anti-aging procedures, please subscribe to our channel and share this video with other friends who may benefit. This is Dr. Jayanthy Ravindran from Tamira Plastic Surgery.